Good afternoon, everyone. Welcome to our English public speaking contest of year 2021. Allow me to introduce myself. My name is Trần Phú Toàn from Nguyễn Kim Secondary School, and I'm from class 2. It's very nice to meet all of you. The weather looks very lovely today, but do you also know that this lovely weather can also make people sick? At present, one of the most serious epidemic in the world called COVID-19. So today I would like to tell you some problem and some solutions to prevent COVID-19. And let's get started. Oh, but wait, before we get started, I want to ask you this. What is COVID-19? And let me answer you that. COVID-19 is a new virus that caused by a new strain of coronavirus. The CO in COVID-19 stands for corona, VI for virus, and D for disease. The number 19 was referred to as 2019 novel coronavirus. This COVID-19 virus is a new virus that brings us some type of common cold. And so we are on to our main question is, what are the symptoms of COVID-19? Well, the symptoms can include fever, flu, or cough, or even cough, sore, and breath. In more severe cases, the disease infection can cause breathing difficulties. More rarely, the disease can be fatal. These symptoms are similar to the flu or the common cold, which are a lot more common than COVID-19. This is why testing is required to confirm if someone has COVID-19. So when all that being said, how does COVID-19 spread? You see, the virus is transmitted through direct contact respiratory droplets of an infected person. Individuals can also be infected from and touching surface that contaminate with the virus or touching their face, for example, eyes, nose, mouth. The virus may survive on the surface for several hours, but simple disinfecting can kill it. So all of you may be thinking which age is being most at risk. Every day we are learning more about how COVID-19 affects people. Older people and people with chronic medical conditions such as diabetes or heart disease appear to be more at risk of developing severe symptoms. However, as this is a new virus, we are still learning about how it can affect the children. We know it's possible for people of any age to be infected with the virus, but so far there are few cases of COVID-19 reported among children. This is a new virus, and we need to learn how it can affect the children. So you maybe wonder, this is a new virus, and we need to learn more about how it can affect the children. The virus can be fatal in rare cases, so far mainly among older people with pre-existing medical condition. So you may be wonder, what is the treatment for it? So far, science is still working hard on the vaccine for COVID-19, but they are still currently available. However, many of the symptoms can be treated or getting early care from the healthcare provider to make the disease less dangerous. There are some clinical trials that are being conducted to evaluate potential therapeutics for COVID-19. So we have altogether been going through what is COVID-19, what are the symptoms of it, who is more at risk, how it can spread, and what is the treatment for it. But besides all of that, I still have one question for you. How can the spread of COVID-19 be slowed down or prevented? As with other respiratory infections like the flu or the common cold, public health measures are critical to slow public health measures are critical to slow the spread of illness. People should public health measures or everyday preventive action that include staying home when being sick, get a medical report, covering mouth and nose with tissue or flexible when coughing or sneezing. Remember to dispose of used tissue immediately, washing hands frequently with soap and water, cleaning frequently touch surface and object, wearing masks to reduce the risk of catching COVID-19 when being in crowded places, and also keep a minimum distance of 2 meters when being exposed. It's also very important to remind other people to keep the distance between you and with the other. Always remember to wear a mask when you're being in crowded place, and also try your best to keep yourself as healthy as possible so that it won't bring other people bothersome. And as this is the end of my line, I very appreciate and thank you for all of your attention. Thank you very much.